we have those firsthand experiences of how healthcare works and doesn't for our patients. And we have our own experiences in navigating the system, which are really helpful to share with people who don't have those experiences and need to understand how the policies they're making really affect people in their day-to-day lives. We're leaders with an important expertise. That medical degree really does make you a leader and someone that policymakers will listen to. And we advocate for our patients all day, every day. So I think there's lots of reasons to be involved in advocacy. I always usually address some of the concerns that people have too. I mean, I think sometimes people say, I don't like politics. I'm not political. I don't want to be involved in politics. And, unfortunately, it is difficult to avoid. So I think we all need to, even if we don't necessarily like the game, we all need to get in there and play our part. Others will say I'm an introvert. So I am also an introvert. It is not natural to me to be, going out and meeting new people and, putting forth my opinions, but I do it because I know that it's important. We'll talk hopefully later about small ways that you can do, because time is often, a huge barrier. But there are very, short things that you can do to advocate and make a difference. And we'll also talk hopefully a little later about how you keep on top of things too, because of course we're all very busy and we would like to, when we say things, we want to know the details behind them. And so, having some resources that are sort of already collated for you and having those brief conversations with legislators is helpful.
Yeah. So, what are kind of some of the issues right now in the diabetes realm that you think are important advocacy points or things that we can help with in terms of the care of our patients with diabetes?
Sure. So I think always, every year Congress will go through an appropriations process for diabetes research and diabetes care. And so one of the big things that the ADA is involved in and that we, can be involved in is really advocating for, appropriations of money to diabetes research.
Sounds good.
Okay, great.
Thanks.
I did. I let them know. If you need to do any video or audio, check with them, Gil.
Yep, I'm here. 1 2 1 2.
1 2 1 2. Perfect. Okay. All right, thank you.
Check these out. Thanks.
Recording in progress.
Prevention program and a $50 million increase for the special diabetes program. So special diabetes programs are particular allocations for increasing funding for type 1 diabetes, as well as increasing funding for type 2 diabetes prevention and management in Native American populations that we see, big disparities in diabetes care and in healthcare in general. And then there are also goals for supporting COVID-19 testing and vaccines in high-risk and underserved communities, making sure that there's more financial assistance for COBRA and ACA marketplace plans, as so many people have lost their jobs this year with COVID. And then as part of some of the legislation that has come out recently, increasing funding for SNAP. So some of the thought is that increasing funding for SNAP can actually make healthier food choices more available for people who need that supplemental nutrition assistance as well, which, as we know, is very important for our patients with diabetes and is often a point where people are making trade-offs, where we don't want them to be making trade-offs, right? They're having difficulty affording their medications. So they're trading off, what they're able to afford in terms of high quality food, when in actuality, if they were able to afford, high quality nutritious food, they might actually need less medication. So getting additional funding, particularly for research and for those particular programs is always on the top of the advocacy list. And that's something you can do sort of at any time. The budget process can be really confusing. It gets delayed. But reaching out to your legislators and just letting them know, like, it's really important that we fund diabetes research and we fund diabetes programs. And I am, supportive of the ADA's platform for, having this allocation. I think another thing that, has been obviously top of mind for all of us and in the news a lot is the insulin pricing and the fact that insulin just costs way too much. So the ADA has had a petition around for a long time, and probably many of you have signed it to support affordable insulin pricing. Before the pandemic, there was legislation that was sort of moving through Congress to address some insulin and drug prices. That kind of fell off with all of the other priorities that have come up. But there are a number of states that you're probably aware of that have placed caps on insulin copays, which is a start. Certainly doesn't address the underlying problem of sort of the complex supply chain and the pharmacy benefit managers. And if you are interested in reading more about the, sort of how insulin gets to be as costly as it is, again, the ADA's advocacy site has some nice sort of brief videos and information on that. But looking at your state's legislation and what is moving through, some of us, like right now, Missouri's, we only have like a January to May legislative session, and sometimes they're in special session in the summer. But so, kind of finding out a little bit more about what your state's doing, what they've had, going through the legislature in past years, what it looks like they might be introducing in the next year, and advocating for some of those, at least some of those insulin copay costs, if your state has passed something like that, but there's a loophole. So, sometimes they capped prices, I think, in Colorado at $100 for insulin, but it was only per medication. So anybody on basal bolus was basically $200. So even once things are passed, sometimes you can kind of find the problems, the unintended consequences, and then contact your legislators to talk about that. Sorry, I I tend to just go on and on and on. So.
No, that was great. That was great. So you were mentioning earlier, so we have, I'm sure the people in this group are passionate about these issues because they joined this, this group. Yeah. But, it can be hard to know where to start. So you can be like really passionate about things and like want to make a difference, but you're also a doctor who is running from clinic to get here, So how do you even recommend people start getting involved, and what are some ways to get involved in advocacy and these sort of issues?
Sure. So I kind of like to think about it as the things that don't take a lot of time, the things that take a little bit more time, and then the things that are sort of much more sort of time intensive. So I'll kind of go through that in blocks. The first thing, we don't think of it necessarily this way, but vote. Make sure you vote every single time, and in every single, your local elections, and the national elections. So that is a form of advocacy, and doesn't usually take that much time, but is really, really important, right? Signing petitions as they come across, they may not have a ton of impact, but they certainly don't take very much time. So that is another way to get involved. And actually, interestingly, so, there are petitions that come across like the ADA's insulin affordability petition, but there may be opportunities for you to sign petitions to get things on the ballot. So one of the things that we did recently in Missouri was get a constitutional amendment on the ballot to expand Medicaid. And that process actually took people going out and collecting signatures on a petition. So you could either sign that petition, or you could be one of the people collecting signatures for that petition to actually get that on the ballot. So that's another way to get involved. It doesn't take too much time. Donating to candidates and causes. I know that as a fellow, you probably don't have a lot necessarily to donate, and there the medical school debt and all of that. But as you sort of get into your attending career and are able to save more and things like that, that's another way to be an advocate and not have too much time, at least, taken out. In terms of figuring out like how to stay on top of things, I think this sort of ties in here. Joining advocacy listservs is really helpful. So the ADA has one that you can join. It's actually sort of two options now. You can be an advocate and they can send you emails. There's another option to be an ADA influencer, which my understanding is that they're going to sort of send more things your way and kind of direct like potentially meetings with your legislators and things when they need that. But if you identify an organization that is doing advocacy work in an area that you're interested in, so like for the Missouri Medicaid expansion, I did Missouri Healthcare for All. They're the ones that are staying on top of like where things are in the process, and they will send you emails, or you can follow them on social media to let you know like, hey, we really need your voice right now. And so that is super, super helpful. I would say like find one or two organizations that are doing work that you feel passionate about and sign up for their listserv so that you get the notifications. They often, when they need you to do something, will have a script that you can edit. And so that makes it a lot easier to just get involved. Influencing your social network. There's postcards to voters for different things. Contacting your legislators, you may think that may take a lot of time, but it actually really doesn't. And so for bills that come up, it's important to ideally call them. Oftentimes their staffers are counting the calls. And so it's important to recognize, I know that's like, that it made me nervous the first few times I did it. But like,
people are scared.
But I know,
Yeah.
but it's not that scary, right? Like, I think we're so used to like texting and emailing and tweeting and other things now, which are all good things to do, but they'll count calls. And so, and if you are like jamming their phone lines with, your many people that care about an issue, that sort of makes them pay attention.
Yeah.
And so because they're just counting, you have to know, you give your ID and your credentials. You say you give your zip code so that they know that you're their constituent. You have your 1 to 2 sentences that you want to say about this issue. If you know the bill number, that's super helpful. But even if you don't, they will know, what you're talking about. And you basically just say you want them to vote for or against it. And they basically, you don't have to have a whole speech prepared is kind of what I'm saying.
And they're not going to like debate you on the phone or anything. They're
Right.
Like,
and so you're getting a staffer usually when you're calling, which is kind of like a medical student or a resident, somebody who's like getting the work done, right? And they are not going to debate you. Exactly. So those are a lot of things that, don't take very much time. You can call a legislator, less than 5 minutes. Certainly signing petitions, joining advocacy listservs, those don't take a lot of time. If you have more time to give, and there's an issue that you feel really strongly about, you can write letters to the editors of your local paper to bring attention to the issue. Those are usually 200 to 300 words, and often pretty likely to get published. There's also the opportunity to write op-eds, which are maybe less likely to get published and are a little bit longer, 600 to 700 words, but may have a little higher profile. Phone banking is something that I've also done periodically, which again, a little bit made me a little nervous. But again, if you're doing it through an advocacy organization, they will have a script. Mostly they want you to stay on script. You can, have something that makes it a little more personal to you. But that is, again, usually done as a way to get out the vote and other things and make sure that people know about these issues. Visiting your legislator in district can take a little bit more time, but is also really impactful. And then canvassing for ballot initiatives and candidates. I know it's not something we've done recently since COVID, but definitely something that is helpful in non-COVID times. And then sort of the final, multiple things may take more time. Attending advocacy days on the state and national level. And doing that with an advocacy organization. Many of our medical organizations actually will, if they have a meeting in DC, will tag a Hill Day onto that. So getting involved with that. And that's helpful because, again, they're providing you their talking points and the issues and what you really need to be focusing on. And then there's other things to do in terms of serving in leadership roles on advocacy committees and serving on the boards of various advocacy organizations. So there's a lot, I guess, there's a lot of ways to get involved, but many of the first ones really don't take that much time.
Yeah, that's great. Thank you.
Yeah.
If you do happen to get a meeting with your legislator or, have someone who you're trying to like communicate your position to, do you have any effective communication strategies? Like what works best, what doesn't work when talking to someone and trying to influence someone?
Sure. So I think, it is always helpful if you can sort of know who you're approaching and know their stance on an issue. So you kind of know where they're coming from. And this is true of, anybody you're trying to convince of anything, right? If you do sort of have a sense of what their stance is, that can help you tailor your message. So that's a little bit of pre-work. You'll introduce yourself again with your credentials, that you're a physician, you're an endocrinologist, or primary care physician working in diabetes care. And then it's really important to have a clear ask, a statement of, what you're, and I would do that sort of right at the very beginning, what you're hoping to convince them of. And then communicate the why behind that. And I would say usually if you can lead with either personal experience or patient story, they respond a lot better to that, like making it individual. So this is an opportunity to really talk about the stories and the experiences that you have in caring for patients. It's also helpful to have data too, but I wouldn't lead with that. I would actually lead with the story so that you kind of draw them in, make them care about it, and then you can have the data. And as much as you can, try to adapt it to the local context and their position. And then if you're meeting either on a Hill day or in district, leave, if you do have like a one pager, you'll often notice if you go with an advocacy organization, they'll have like a one pager that they can leave behind. You can leave behind with the staffer or the legislator. Leave your business card. And then it's helpful to write just a brief thank you afterwards to just, sort of remind them of who you are and what you talked about, and thank them for their time as well. So that's kind of the basic rubric for that.
Awesome. Well, Megan asked if you have the activities like, from short to long in a list form that you could share.
I do. I can. Yes.
So maybe you could share that with the ADA staff and then they can like
Sure.
send it out or something. That would be great.
Okay.
And then if anyone else has any particular questions, you can type them in the chat. We have like 2 minutes left.
Oh gosh, it went really fast.
Yeah, it was super fast. I know. So yeah, and then just kind of on a final note, is there anything that people can do? Like, how can people be good advocates locally for their patients in their community? Is there any particular resources you recommend or ways to be a good advocate for your individual patients?
Sure. So I think, educating ourselves and our colleagues about some of the things that are available for people, certainly patient assistance programs, opportunities for accessing 340B pricing, which is often available through resident clinics at academic centers and federally qualified health centers. Knowing about things that make supplies cheaper. So the Walmart Rely On brand, AccuCheck and One Touch both have payment programs that make the strips a little bit less expensive. There's an organization called CR3 Diabetes that does pump supplies. People can donate their pump supplies and then they provide pump supplies for people that can't afford them. And a number of other organizations like the pharmacy assistance programs, GoodRx and things like that. So, and sometimes these things change over time. All of the major insulin programs now do have patient assistance programs that can be super helpful for people that are uninsured. Again, not a sustainable solution, but when you're, working one-on-one with that patient is often really, life-changing in terms of being able to get them the insulin that they need.
Yeah, well, thank you. Well, so everyone knows, if you wanted to click real fast, the room is closing in 30 seconds, but I shared the 2 links to becoming an advocate through the ADA and then also becoming an influencer through the ADA in the chat. So if you want, while you're sitting here in this meeting and you have time to sign up for those things, that is one way to stay informed, at least about the ADA's advocacy priorities.